We have a lot of different type of interventions that we can offer for people that have spine-related pain. And I tell people there's two primary reasons we do injections. Number one, help you feel better. Number two is actually to help figure out where pain comes from. So if someone gets relief, even if it's temporary, we say, hey, this is good. We know we're in the right place. One of the most common procedures that we do is an epidural injection. An epidural injection is to treat nerve and disc-related pain. And that's because of the space of where the medication goes. So when we do these injections, it's in an outpatient setting. So you get to come in, go home the same day. The procedures are relatively quick, but we do them in an operating room with an x-ray machine to keep them safe. And so an epidural injection treats neck or back pain. It also treats nerve-related pain. So that would be pain that radiates from your neck down through your shoulder and arm, or radiates from your back down through your leg. And we commonly call that sciatica, and that's just a way to say radiating nerve pain through the leg. And so when we do injections like that, we're in an operating room with an x-ray machine to keep them safe. And the medication would go, and we got a model of the spine here, around where the nerve and disc is. So the bones of the spine are there to protect the space of the nerve and disc. And when we do injections on the nerve and disc, we got a needle down to where that space is, and that's the epidural space. And then we're able to bathe the space around where that nerve and disc is, typically with a mixture of numbing medicine and steroid. And that's helped to get rid of pain and inflammation. And so an epidural injection is one of the more common procedures we do in interventional pain management, and that goes around where that nerve and disc is. The other type of procedure we can do is related to the joints. So in the structure of the spine, the joints are along the sides and back, and the joints are the structure that act as cushions in between the bones on the backside. You can kind of think of them like knuckle joints. Just like knuckle joints, they can get arthritis in them. So if you get arthritis in the joints in the spine, that usually causes kind of an achy, dull pain. And so the joints have nerves that go into them. And so there's different types of injections you can do. You can do an injection into the joint itself. So compared to an epidural injection, it goes in a different space. It goes in the space of the joints. The joints also have nerves that control the pain signal from them. So sometimes instead of doing a steroid injection into the joint, we can do an injection where we block the nerve that goes to the joint. Blocking the nerve that goes to the joint is kind of a test. It's a diagnostic tool. So it helps us figure out, is the pain coming from the joints? And if we can confirm that the pain comes from the joints with the nerve blocks as a test, then for the long term, we can do this procedure called a radiofrequency ablation or a rhizotomy. So we actually go in and cauterize and burn the nerves that go to the joints. And that's to try to help cut the pain signal off more for the long term. A nerve block works temporarily, only for a few hours, but if it helps us know we're in the right place and we can go back and do the ablation procedure, that can give someone longer term relief. So typically the radiofrequency ablation is a procedure that can provide relief anywhere from 6 months to 18 months, so up to a year and a half. What happens is the nerves can regenerate, so slowly over time they can grow back. Sometimes that means pain comes back, and if that's the case, the procedure can be repeated to get pain relief again.